Microbiology, NEET PG 2025 paper solution. Question. Group A Streptococcus is most common cause of bacterial pharyngitis on school-aged children. Which of the following bacterial components is primarily responsible for attachment to fibronectin on the epithelial lining of the pharynx? That is your lipoticoic acid. We remember ticna is for attachment. A 25-year-old sewage worker presents with fever for 1 week and weakness for 1 day. Lab shows elevated bilirubin, decreased urine output. There was conjunctival redness, and there was also mention of microagglutination test. Your diagnosis is Weil's disease, ectohemorrhagic fever, hepatorenal symptoms. People had confused this with hemorrhagic fever because they had mentioned there is redness in the conjunctiva, but Weil's disease also has conjunctival hyperemia. In a village, several people developed dysentery after consuming raw milk, and on laboratory examination, it was not a village, actually, it was um, a place where people had gathered and someone brought raw milk and everyone got sick. They had blood-stained diarrhea followed by watery stained diarrhea. They also had vomiting present, and the answer here is Campylobacter jejuni. The food here was raw milk with nocturnal perianal itching. The image shows the following egg, D-shaped egg. There was also a Scotch tape test done. Mother saw the worm. Diagnosis is Enterobius vermicularis. A patient presents with low-grade fever, chronic cough, and weight loss. Fungal culture of respiratory secretions shows the following organism, narrow base budding. What is the likely diagnosis? Histoplasmosis. A patient presents with history of chronic meningitis. Laboratory test shows gram-positive filamentous branching bacteria, positive ZN stain growth on paraffin bed culture. Which of the following is the most causative organism? That is your nocardia. A male patient presents with fever, cough, and hemoptysis. Ball shows septate hyphae with acute angle dichotomous branching. What is the diagnosis? Aspergillus. A patient presents with recurrent infections with Neisseria gonorrhoeae. Which of the following investigation is the most appropriate to evaluate the underlying immunodeficiency? They have this terminal complement C5 to C9 acid deficiency. The answer is D. Farmer presents with ulcerative skin lesion showing signs of necrosis. Smear from the ulcer stained with polychromethylene blue reveals capsulated bacilli that are McFadden reaction positive. What is the most likely causative organism? That is your Bacillus anthracis. A middle-aged man from an endemic region presents with swelling in the lower limb. The photo is given, you just have to tell what kind of obstruction it is. It is your lymphatic obstruction.